And before we start reviewing numbers and charts today, I want to talk bluntly with you about two critical issues that underpin all of the data I will share. The first is the spread of COVID-19. We are at a dangerous point. The number of cases in Ontario is growing between 3% and 5% almost every day. There are already more than 400 COVID-19 patients in our intensive care units, and mortality in our long-term care homes is now on a pace to exceed the tragedy of the first wave. But as importantly, COVID-19 is now in every region of Ontario. This is no longer a problem of a small group of cities or one region of the province. More than half of our intensive care units in Ontario are full or have only 1 or 2 beds left. 40% of our long-term care homes are an outbreak. The pandemic will have serious consequences for our health in every region of Ontario. I know that the people working in our hospitals will do everything to help cope with this crisis. Hallways will be used to house makeshift intensive care beds. Field hospitals will hold patients throughout the winter. But as we climb closer to 1,000 intensive care beds, about half of our capacity, filled with COVID-19 patients in February, we will have to confront choices that no doctor ever wants to make and no family ever wants to hear. They will be choices about who will get the care they need and who will not. There'll be choices about who receives oxygen or is transported to hospital. Decisions we are already seeing being forced on ambulance crews in California, where the virus has spread widely. And I want to emphasize that the choices will affect all patients needing intensive care, whether it's patients who have a heart attack, who've been in a motor vehicle accident, who have COVID-19, or any other cause. This also means care for thousands of patients waiting for surgery will be delayed or canceled while we add more patients to these wait lists. It is critical to remember that when care is delayed, patients get sicker and their prognosis worsens. Simply put, delays kill. At the same time, the impact in our long-term care homes is as or more devastating. We already have well over 1,000 deaths in long-term care in this second wave, but we also have to acknowledge the anguish and the heartache of our most vulnerable senior citizens as they are cut off from their loved ones, as long-term care homes struggle to keep the virus out. As you'll see from the maps I will show today, long-term care homes across the province are now affected by COVID-19 outbreaks. And as the virus spreads, so will the outbreaks, and so will the deaths. And I want to be clear, the impact on our health system is already greater today than we have ever seen in Ontario's history. If we look at just one community as an example, Scarborough has already had many times more emergency department visits and hospital admissions than in an entire bad flu season. And we are now only a few months into this second wave. And as my colleagues have shown, using Ontario data, the impact of COVID-19 is far greater than diseases like flu or anything else that it's regularly compared to. And the stakes have just been raised. We'll discuss today in the briefing a new variant of COVID called B.1.1.7 that has likely arrived from the United Kingdom. This variant is in the province right now. Today, the number of Ontarians with COVID doubles every 35 to 40 days, roughly every month to month and a half. But this new variant, if it spreads, will mean that the doubling time for cases could drop as low as 10 days. Now, the vaccine and this new variant is not more lethal, but because it spreads so much more quickly, if it gets out into the community, there is no question that we'll have more cases and many more deaths. People will die from the virus itself and from an overloaded health system that is unable to respond to their needs. The second key issue for today is controlling the spread of COVID-19. As you will see in the upcoming slides, the majority of Ontarians are working to follow the public health restrictions. Thank you. Your actions protect yourself, but they also protect other Ontarians. I know this can be hard work, and I know this involves hard choices about seeing loved ones and friends. But our actions are key to controlling the spread of the disease. However, there remains a substantial number of Ontarians who are not following restrictions, and their actions will undo the hard work and effort of those Ontarians who do. If we do not follow these restrictions, COVID-19 will continue to aggressively spread before vaccines have the chance to protect us, and this will have tragic consequences for us, for our health, for our province, and for our health system. The vaccine will come, and it will be in people's arms before many of us really even understand how quickly it's moving. But that is still months away. We have a big job to do right now. Any restrictions will take time to have an impact, but stopping the growth of the pandemic is not impossible. Other countries have witnessed the same growth that we have, and they've taken action by enacting and enforcing higher levels of restrictions. And it has worked. The Australians celebrated New Year's Eve, and their shops are open. The French have cut their cases by half, and Germany is flattening its curve. But we must also support Ontarians who, by virtue of nothing more than the work they do and the communities they live in, face much greater risk of exposure to the virus. This means greater and more accessible testing, close engagement with community leaders, and support for people who do the essential work we all rely on every day, so that nobody has to choose between getting a test and putting food on the table. This means making workplaces as safe as possible. It means support for isolation when someone tests positive. It means income support, and it means protection from eviction. As I move into the numbers in today's briefing, I want to say a special thanks as well to Dr. Beata Sander and her team, who have been instrumental in producing today's and many preceding briefings. And with that, I'm sorry, but the sign language translation will disappear as we go into the slides, and it will be back as soon as we're finished presenting the slides.